Now, Norman mentioned contact tracing. A clinical contract tracer has told us exclusively she spent much of her time since the government's track and trace system went live watching Netflix because she hasn't been assigned a single case. The government scheme, as you know, began in England last Thursday. The woman who I've been speaking to is a nurse and has worked around 38 hours in total so far over several shifts, earning £17.35 an hour. She says she hasn't made one call in that time and feels guilty for being paid to sit idle. I spoke to Becky yesterday evening. It's not her real name because she asked to remain anonymous.
It was on the Downing Street briefing on Wednesday, led by Matt Hancock, when I found out that the system was going live on Thursday morning. Since the system's gone live, I've worked 38 hours as a contact tracer. I've been available to work as a contact tracer since it went live. And I'm yet over 38 hours to make a single phone call or be assigned a case.
So you've worked 38 hours as a clinical contact tracer on shift since this system went live and you haven't phoned anyone?
No, I've had no contact from anyone. I've had no contact from supervisors. I've literally been on the system, refreshed the system and entertained myself during that watching Netflix.
What are you watching?
I've been watching A Good Place. I've returned back to season 1 and now I'm halfway through season 3. I've just watched it alongside going back to the system, refreshing it, occasionally having to log back in because it's timed out. I've yet to have any contact with anybody regarding contact tracing.
So taxpayers are paying you to watch Netflix?
Yeah, and it's frustrating because, I've signed up to become a contact tracer in my professional capacity, which is, underpinned by public health. The reason why I've signed up to do this is to support the greater good of our communities. I live in a high incidence area and I assumed for that reason that we would have quite a few calls to make in relation to contact tracing in order to try and control the virus. I'm disappointed that I'm sat idle when I could be otherwise giving my time to maybe wards within the NHS. I would normally pick up shifts elsewhere. It's just very frustrating. And what I find most frustrating is the lack of transparency. And what I'm doing here is trying to offer transparency from my professional perspective. Now, I can't speak for other contact tracers, but myself and my own personal experience, I'm yet to apply any of my professional skills as a nurse in the role as a contact tracer.
And why do you think you haven't had to call anyone? What's going on?
It's a difficult one, really. I mean, I can't imagine it's because we haven't had positive tests, because it's apparent that we are still getting quite high numbers of positive tests. I would suggest it's possibly because we haven't yet got a system which is ready to function and it's been pushed forward prematurely. And as a member of the British general public, I would prefer for people in government to say, it's not ready yet. Hang fire, step back, let's wait a moment. It's still dangerous out there. We need an effective track trace system so that we can start to release lockdown when we've got some control of this, instead of giving the illusion that there are systems in place to try and control it. And I don't personally feel that that's where we're at present.
The Health Secretary, Matt Hancock, said to MPs today, I'm just going to read it, he thinks the test and trace system is, quote, working well, as thousands of people have been contracted, like you, and their contacts traced. What do you say to that?
From my 38 hours of experience as a contact tracer since going live, I've not made any contacts. So from my personal experience, I can't see that that's been occurring, unless there are people who are in the same position as me who are getting the phone calls to make. Personally, I've not had a single phone call since it went live on Thursday.
I mean, maybe it's good news. Maybe we're all observing social distancing so much that there is no one you need to contact to tell them that someone they've been close to has had a positive test.
I think if you look across the media, it's quite apparent that there's lots of people in groups at beaches, in parks, in other beauty spots. I think that some of the social distancing has become lesser. And even from my experience of popping to the supermarket, there's not a lot of social distancing occurring. So I feel that there's a false sense of security that we're kind of stepping out of the danger zone and that there isn't disease.
Do you feel guilty just sitting there refreshing your screen and watching Netflix?
I do, yeah, definitely. I've gone into nursing because it's a vocation, and I've gone into this role with the intention of providing care for people in whichever capacity I can. This contact tracing idea, which is working in other countries, like in Germany, it's quite effective. It's frustrating to know that I am sat idle when there is people that need contacting. I can't understand why we haven't had any contacts. It doesn't make any sense to me.
What do you think of that?
I think it's appalling. I think it's dishonest. And that is one of the fundamental concerns about this. We're trying to build a very large system that's trying to keep people in England safe, to try and prevent a second spike. I understand it's complex and I understand that there's going to be challenges, but from my perspective as a citizen of England, I would prefer honesty. It's not ready yet. Hold fire. You know, they've released aspects of lockdown which without track and trace it's not safe to do so. Not having a system up and running is obviously frustrating, but it's about people's lives.
Becky, thank you very much for talking to us. Well, the Department of Health and Social Care told us in a statement the new NHS test and trace service is up and running and will help save lives. These claims do not reflect the huge amount of work already underway. Anyone in this country can book a test, and we have over 25,000 contact tracers in place to undertake this vital work. I'd really like to hear from you this morning. Have you been called by a contact tracer? Do let me know. You can message me on Twitter @VicDerbyshire or send us an email, victoria@bbc.co.uk. Deborah says, I was tested last Monday, more than a week ago, and still no result. I've chased 3 times. If my experience is widespread, contact tracing, totally pointless. Kelly says, what do people expect of the TNT system? It's brand new, it's in its infancy, and it's going to take time. Would people rather the government didn't set this up and we needed it? Give it time, for goodness sake. Hi Victoria, I was contacted by a tracer 2 days after my partner was diagnosed with COVID-19. On the first call, the computer system crashed, so they said they would phone me back the next day. They did. It crashed again, so they rang me back the day after that. They asked for my name, address, date of birth and phone number. I was told it would last 20 minutes and consist of questions and advice. After 3 minutes and divulging my personal information, it was over. Ricky says, what is so hard to grasp when it comes to the contact tracers? If there are 25,000 tracers but only 2,000 confirmed cases, there is going to be some who aren't going to be doing much. Please can you stop with this ridiculous storyline? And Emma says, a friend of mine requested a test last Wednesday, still nothing in the post. Can't track and trace if no one tests positive. So really interested to hear from you. Have you been contacted by one of these contact tracers? Do let me know this morning. I want to introduce now Anthony Costello. He's Professor of Global Health at University College London, a former director too at the World Health Organization, and he also helped set up the Independent SAGE, so-called Independent SAGE. That's a group of scientists who question the UK government's response to the pandemic. Professor Costello, hello to you. Good morning.
Morning.
Let me read you this email from Graham, who's messaged me to say, please drop this story. 2,000 cases, 25,000 contact tracers. Many of them will never see a single case if the infection rate remains low. Drop the story, it's annoying. Is he right?
Well, no, because there should be 8,000 a day, according to the Office for National Statistics. So over that 3-month period, there should have been 24,000. OK, some were asymptomatic. But it means that this system is not picking up more than maybe 20 to 30% of cases and is missing probably at least 2/3 of contacts. And that's why your nurse has not had any calls. My big worry about this, it's clearly not fit for purpose yet. The worrying thing is, can it ever be fit for purpose, and why was it set up like this? You need speed and you need trust. It should be local. It should be integrated with GPs and public health. It should be sustainable. Why did they not set up one test, trace and isolate hub for every 30,000 population, every primary care network? Your GPs would have been there to reassure you if you're a case, to monitor you, to know about your underlying conditions and follow you up. That's the obvious thing to do, and they can test. They could set up tests and get results back within 24 hours. That's not happening with this separate commercial system, and I don't think it's going to work with the contact tracing by reset.
There are a couple of issues, certainly from viewers who are contacting me. One is that people are being tested, but it's taking over a week for them to get the results back. So that would obviously lead to a delay with the contact tracers. Mike in Beverley says, my daughter-in-law, who is a key worker in the hospital, was tested positive last Thursday. My son, who is a policeman, tested positive on Friday. They're now both isolating. As of today, nobody from Track and Trace have contacted them. Why? What is going on? What's breaking down in the middle, do you think?
Well, exactly. If you don't get results back and you don't chase your contacts until much later, then the system becomes a bit pointless. Are we going to actually build a protective shield that will give us the confidence to know we're locking down the cases and contacts we really want to, so that everyone else can get back to work and the economy can get going again? It's got to be speedy. It's got to be trusted. And I don't have confidence at the moment that it is. The other thing is that the tests being done in the commercial sector, they don't collect postcode or address details. So nothing goes back to GPs. And we don't have the numbers of tests by locality, which is very essential because there are big changes. I mean, I looked at this data. In London, there's very low testing rates at the moment, low number of cases. Birmingham, Bradford, Lancashire, Kent, Essex, much higher rates. We need to know this so that local authorities can respond appropriately.
I mean, a number of people are saying, look, it's really good news. It means everybody's following social distancing. We're sticking to the 2 metres. That's why people aren't being contact traced. Is that fair?
Yeah, it may be a factor. Of course, we've had social distancing, although it has been loosened up in the last week or so. But we simply don't know. I mean, in many other places, you would expect more than 2.5 close contacts. And in, when we get back to a kind of normal economy, it may rise to 10 or 20. Look, it's early days and the government will say, give us time. Yeah. But, they've opened schools this week, and Independent Sage said they recommended waiting another 2 weeks before they did that, so that this system was in place. And at the moment, Independent Sage is looking at the whole test, trace and isolate. We'll have a public consultation on Friday online and produce a report next week to see whether we can tweak this system to try and make it work.
The clinical contact tracer I spoke to said she believed we've got a system that isn't ready to function and it was brought in prematurely. Do you think there's something in that? And if so, why? Why would it have been brought in if it wasn't quite ready?
Well, absolutely. That's what we've been saying for the last 2 weeks, that the risks to, for example, children and more, especially their home contacts, would halve if you waited another 2 weeks. And it would also give you the added protection. I mean, it's kind of crazy to think that you can introduce a national program on a Thursday and it's going to all be up and running and working smoothly by Monday. Clearly, that hasn't happened.
Is it giving us a false sense of security, as the contact tracer suggested to me?
Yeah, it is, because clearly we're not picking up the cases and not picking up enough contacts to make any real measurable impact. And, there are more cases out there in the community than people realise.
Thank you very much for talking to us. Thank you. Professor Anthony Costello, former director of the World Health Organization, and helped set up so-called independent SAGE. That's a group of scientists who have been critical of the UK government's handling of the coronavirus crisis in this country.